Welcome back to our second session today, which will deal with harnessing the digital transformation of health promotion and disease prevention. Now, already in the previous session, we had a couple of interesting discussions about the digital transformation. I mean, Mr. Seka, for example, emphasized that it's more the transformation that is important and less so the digital aspect. Is certainly also important, but what is more important is certainly the transformation aspect. And what we see in many different aspects of life, a huge movement towards digitalization. For example, I just read in a report that more than 300,000 apps are available which deal with healthcare issues. 300,000, more than 300. I mean, how can such a large number of mobile applications be developed? I mean, it's really amazing. And it also poses, I mean, a lot of certainly opportunities and a lot of challenges. Now, certainly among the opportunities, and certainly all speakers will speak about those issues. I mean, they can greatly help not just apps, but also all kinds of other equipment which are digital and can help monitor health, can lead to better health outcomes. But also a number of challenges. For example, one issue is inequality. It was already mentioned in the previous session that there are rather significant health inequalities. And also a possible issue with all of these digital applications is that those who are more digitally literate can use these applications. And these are typically the people who are better qualified, better educated, and anyway have better health profiles. So they might improve further. But those who have much less literate in digital issues might find it more difficult to use such digital tools. Another major issue, in my view, is data privacy, data ownership and control. I mean, all of these apps are sending data through, I mean, whatever third parties, and many times we are simply not aware of where the data is actually going to and for what purpose the data is using. Another important issue is quality. I mean, I mentioned there are just 300,000 mobile apps. Now, how can we be sure that these are all indeed good quality and give you good advice and good recommendations? I mean, as far as I know, in some countries they have some frameworks in place to assess these digital solutions, but certainly, I mean, just the sheer number of them makes it very difficult. So I think we have a great panel to discuss these and many other different issues. Let me just briefly introduce them and then ask them to intervene. Stefania Boccia, if I hope you pronounce Boccia, I'm sorry, who is a full professor of hygiene, preventive medicine and public health at the Catholic University of the Sacred Heart in Rome. And she also has many other positions, including she's the president of the Public Health Epidemiology section of the European Public Health Association, EUPHA. And I also read in your bio that you have more than almost 5,000 citations, which I'm also, I mean, I'm trying to do academic research. I mean, it's a very impressive number. So Stefania is indeed publishing a lot and also very influential in her research and publications. Then we have Martin Dorazil, who is the deputy head of unit at DG Sante of the Commission. And in alphabetic order, we have Michael Stubrin, who is the director of digital health at MedTech Europe. So we have let's say an official, we have an academic, and one from the third speaker from the industry, which I think is a very great setup for discussion. So we thought we would start with Martin to start with let's say an official, then the academic, and then the industry view. So the floor is yours.
Yeah. Good morning, everybody, and thank you, Zsolt, for the introduction. So my name is Martin Dorazil, and I'm representing here the European Commission. I'm a deputy head of unit responsible for European reference networks and digital health. And for my introductory remarks, I prepared a few slides just to give you an overview of the recent activities at the European level in the area of digital health. And I will also a little bit touch upon the future and the challenges and opportunities that are ahead of us. So if I look back a little bit at the recent developments at the European level in 2018, the Commission adopted a communication on digital transformation of health and care, which sets out the main lines of actions for us for the years to come. And the whole strategy outlined in that communication was structured along three main strands. The first one is to give citizens better access to their health data anywhere in the European Union. The second strand concerned connecting and sharing and pooling of health data for research, faster diagnosis, and better health outcomes. And the third pillar, or the third strand, concerns better use of digital services for citizen empowerment and person-centered care. With regard to the first area of work, the communication set out a number of initiatives and plans, and we are already making progress on many of them. So, for example, we set up a platform for electronic exchanges of electronic patient summaries and e-prescriptions in cross-border settings. So, for patients who are receiving healthcare in another member state, this allows healthcare professionals to have access to their patient summary. So at this stage, it's not full electronic health record, but it's a first step. So they get access to their patient summary, and also the system allows for dispensing of medicinal products on the basis of electronic prescription in another member state. And there is supporting infrastructure already in place. Member states are governing the system via the so-called e-health network, which is a voluntary network of the member states discussing and taking measures on e-health. We are also working on increased interoperability of electronic health records. So last year, in 2019, the Commission adopted a recommendation on electronic health record exchange format. We also last year adopted a new Commission implementing decision on e-health network, which is the voluntary structure that I just described, that improves the governance of the network and also addresses certain important data protection issues related to the cross-border exchanges of patients' data. And we are also providing support to the member states' collaboration, because member states are primarily responsible for organization and financing of healthcare. So, for example, we are funding a joint action of the member states in the area of e-health. This slide just very briefly provides the fundamentals of the e-health digital service infrastructure, which is the infrastructure for exchanges of patient summaries and e-prescriptions at this point in time. But in the future, the intention is to extend it to further use cases, such as exchanges of laboratory results, medical images, and hospital discharge reports. I mean, on this slide, in a kind of a graphic form, I try to explain how the whole system works. Basically, it's based on the national contact points that are connected via this the e-health digital service infrastructure for exchanges of patient data. With regard to the second strand of work, it is crucial that we enable better pooling of data, not only for the provision of healthcare, but also for the purposes of health research, for prevention, improving personalized healthcare. So I'd like to mention in this context two specific examples. One is the 1 million genome initiative, based on a declaration signed by a large number of the member states in 2018, and today we have 21 member states plus Norway that are taking part in this initiative, with the objective to pool together the available genomic data in a way that this information and this data would be accessible across the European Union. The other specific example I would like to mention are the European reference networks for patients with rare diseases or complex low prevalence diseases, where we are bringing together experts and expert centers dealing with those specific diseases, and this is a very nice example where the European cooperation can bring significant added value directly to patients. And we allow these networks of healthcare providers and specialized centers to convene virtual panels and virtual consultations, so that the underlying principle is that we should avoid as much as possible patients traveling around Europe, but rather the knowledge and expertise should move ideally by using the new technologies. So currently we have 24 networks for different rare conditions. These networks are bringing together more than 300 hospitals and more than 900 healthcare units. And currently there is an ongoing call for new members to join these existing networks, and we are processing a large number of applications that we received. And these networks, they do not only improve patients' access to the healthcare they need, but they should be also focal points for research on rare diseases, for development of clinical guidelines and so on. And the last important strand of activities is the strengthening citizen empowerment and person-centered care through digital tools. We are supporting better uptake of and deployment of digital solutions in the area of healthcare, and there is a number of financial instruments available or under negotiation within the framework of the new multi-annual financial framework, such as the Digital Europe program, Horizon Europe, European Social Fund, and the European Regional Development Fund that provide opportunities and possibilities for funding for projects in the area of digital health. I should also mention that last year the eHealth Network adopted investment guidelines that also set out the important principles for that are relevant for eHealth. So this is the work that we have been doing until now, and or the projects that are in the pipeline and they are ongoing. But there is also another relatively new area of work which now becomes more prominent in the work of the Commission, You probably know that in the mission letter to the Commissioner Kyriakides, who is responsible for health, a specific task was mentioned by the President von der Leyen, and this is the work on the creation of the European health data space to promote health data exchanges, support research on new preventive strategies as well, treatments, medicines, medical devices, and outcomes. And this is the quote from the mission letter. Because health data are very important for the provision of healthcare, but they also offer a huge potential for health research and health policy making, and also development of new health technologies and products. But currently, this potential is not sufficiently used, and there are also a number of challenges and potential obstacles that need to be addressed before this potential can be fully exploited. On this slide, I put some of the issues or challenges in a random order, so it's not that one would be more important than the other. But if you look at it, I mean, currently, for example, researchers may or have difficulties to access the health data they need. And there are also important data protection implications that were brought by the new GDPR. And other regulatory gaps and barriers preventing a smooth provision of digital healthcare. There are issues linked to the interoperability and quality of data. So data from different sources are not able to talk to each other. There are certainly, I mean, big challenges in terms of appropriate infrastructure being put in place. Issues related to cybersecurity and security of data, because we are talking about sensitive personal data. Even the GDPR recognizes that health data are a specific category of sensitive data. Artificial intelligence is more and more being deployed, but this brings also ethical issues and questions related to the safety and liability. And one important element that should be emphasized is the need to avoid new health inequalities. So we should not, by promoting, I mean, the digital solution, so we should be very careful that we do not create new divides between regions. Or between different population groups, for example, based on their age and in particular on their health literacy and digital literacy. Other issues that I can just mention are not on the screen are also digital skills of healthcare professionals. That's also another area which is very important to be addressed. So at this stage. We are conscious of all these challenges, but also opportunities, and we are collecting input from all the different stakeholders on the best way forward. We are also conducting different studies and expert workshops and events, trying to map the landscape in the member states and collecting the information of what already exists, so that we. In the future can work further on these issues, and in particular, so far in the discussions, I mean, what we identified is the need to work on the appropriate governance structure for the access to the health data, especially for the secondary use. We also need to further consider the appropriate infrastructure that needs to be possibly put in place or upgraded, and also the issues of interoperability need to be addressed. So I will stop my introduction here, and at the end of my introductory remarks, I would just like to emphasize the sentence that is at the bottom of the screen, that we need the active engagement of all parties in this endeavor. And we are seeking for a triple win solution that would benefit people and patients, but also health systems and also the health industry. Okay, thank you.
Thanks. Thank you very much, Martin, for this very nice overview of the various different aspects of the Commission promotion for digital health. Let me just have one quick follow-up question, namely on how do you see the progress that governments, member state governments are making? For example, you mentioned the setup of these e-health national contact points to which national service providers, a lot of data would be going, then all of these national networks would be connected via European networks, and that would provide a lot of data and allow to better diagnosis and research. So how do you see the progress of different member states with that, and why some countries are doing better than others?
Yeah, thank you for the question. The short answer is it's quite diverse. So this situation differs member state by member state. There are member states that are kind of leading the way, and they are more advanced than the others. That's for sure. As I mentioned, we bring the member states together in the e-health network. Then we have all the member states represented, but the level of readiness, for example, to join the exchanges of patient summaries and prescriptions is different in the member states, and also in terms, for example, of the initiatives and actions taken at the national level for the access to health data for the secondary use is also different. With regard to the e-health network and the exchanges of patient summaries and e-prescriptions, however, we hope that by 2020 we will have at least 22 member states being part of these exchanges. So they are in the process of joining, but the other aspects are diverse. And as I said, currently we are collecting the information from the member states and mapping the situation, and I will be definitely better place to provide more comprehensive answer, possibly later this year after we've finalized this mapping exercise.
Thank you. We look forward to receive that report. Now, Stefania, the floor is yours.
Thank you. I prepared some slides. I don't know if they're coming. Okay. So generally speaking, I think that we all agree that digital transformation represents one of the key drivers of innovation that really brings the potential for our healthcare systems to be more effective, equitable, accessible, resilient, and comprehensive. This has been acknowledged specifically by this project also that is just about to end. Is the To Reach Transfer Innovation to Health Systems that was also participated by the European Observatory, that was also publishing very recently a strategic research agenda on health system research, where a key pillar was in fact devoted to digital transformation. However, when we talk about digital transformation in health, I believe that we talk also about a cultural and an organizational process, and so things are much more complex, because we not talk also about technologies, and also makes more complex all the kind of evaluation that can be done in this sense to understand what is a really value-based intervention from the digital transformation side. So today I was asked to give an advice on the impact of digital transformation on health promotion and disease prevention. So in doing so, I take advantage of the European Public Health Association conceptual framework that has been published quite recently on the potential added value of digitalization for public health. Actually, for those who are not aware, EUFA is a very important organization that brings together several institutions working in public health across Europe, and involves around 20,000 public health professionals and experts across Europe. And very recently, as I said, they published this conceptual framework, and they did envisage that within the digital health technologies that were likely to have a broad impact on risk prediction, prevention, and health promotion are mobile health technologies and genomics. I have to say that this is something that should not surprise at least those who are already engaged, as me, in public health genomics, because as you can read from the other picture on the right side, this is it cannot be read unfortunately, but this is a picture taken from a report of the Public Health Genomic Foundation, which is a think tank based in Cambridge, where they represented in this picture how strong is the connection between the red side digital technologies, mobile health technologies, but also the genomics one reported in purple, but also the other technologies, robotic, artificial intelligence, and the Internet of Things stuff reported in the orange color. All these things are so strongly interconnected because they, in principle, bring the potential to make a very precise intervention, not only for the curative setting, but also for the preventive side. So if we can focus at least for the first part, mobile health intervention. So I try to be brief, but I cannot avoid to tell you that the expert panel on effective ways of investing in health just released this report for the Commission. They were asked inter alia to also assess the impact of digital transformation of health services, and they included in their large report this umbrella review, which is a very large review of reviews, and among these reviews, those that were reporting on a positive actual impact of mobile technologies in health prevention were addressing smoking abstinence rate using a mobile phone cessation program. And this is definitely in line with the companion report that reports the same positive trends of positive impact in behavior control with such kind of mobile health technology. So I have to say that beyond that point, however, evidence for efficacy in health promotion are quite limited. So at least the expert panel pushed to gather more high-quality evidences, also long-term studies, also coming from low-income countries that are overall very low underrepresented. So these, again, issues of inequalities. When it comes to the efficiency of such mobile health interventions, the expert panel reported this primary review that included some studies that overall are few, but the trend is again positive, which means that the few studies performed so far report quite positive cost-effective value and also some cost-saving evidence in some situations. So again, I have to say that I feel quite positive in this position, but we have to expect more evidence accumulating to give, a strong voice and advocacy in this sense. When we move to genomic technologies, I have to say that I am the first one to acknowledge that there was a lot of overhype among genomics and the impact, at least in the field of prevention, that has been only partly fulfilled so far. And also as a public health professional, I have to admit that this is something that is difficult to understand for some public health professionals, because we talk also always about community, we don't talk about individuals. So if you start thinking about genomics, then public health professionals say, well, they feel very skeptic because they say, well, I don't care about individuals, I care about community, but we cannot avoid to think about profiling our community in order to provide more targeted interventions, also in the prevention setting. At least this is what I believe. In fact, in this report you can read on the right side, I did contribute many years ago, but this is something that we now, today we discuss about the fact that genomics is one of the components of an innovative approach that, together with data coming from self-monitoring quantification from comprehensive electronic records, contribute to stratify our population, to have more additional information, which are not that special, respect to other lifestyles or other behaviors that population have. Of course, we have some sensitive issues. I do not regret about this. So the point I want to raise now is to what extent we can say that genomics have contributed to prevention and to health promotion. So I want to show you a couple of examples. Polygenic risk score. This is something that in the past few years we really heard a lot about this, and there is a lot of pressure also about the industry, because a lot of studies have been accumulating that really shows quite strongly that these scores that are very easily calculated by characterizing some single nucleotide polymorphism associated in genome-wide association studies with chronic disease, they give a stronger prediction power to develop chronic disease since birth. So the question is to what extent we can use this information to provide more effective prevention. I don't have an answer yet today, but some evidences are accumulating, and we should pay a lot of attention, I guess, in this sense, because at least in the United States, citizens ask about that. We don't have that situation yet in Europe, but it's very about to come. This example, I don't want to go too much in detail, it's a very scientific paper, but in this example, it's about very large cohorts, 20,000 subjects each in the 3 different cohorts of healthy subjects. Coronary events have been already traced, and blood samples have been stored, and they've been now genotyped for a polygenic score validated that gives information on the coronary heart events risk in the future. So what the authors did is they tested whether engaging in certain favorable lifestyle habits modify the inherited risk of coronary heart events. And they were able to see that in the last chart on the right, in the high genetic risk group, high risk of coronary events, there was the highest impact of favorable lifestyle, that were able to halve the risk of coronary events. Of course, it is a retrospective done study, so people were not aware of that. But can we use this kind of information to trigger more healthy lifestyle behavior by providing people information on their genetic background? We don't have an answer yet, as I said, because there are research now ongoing that are trying to combine this information with the use of mobile technologies to see whether people can really start engaging in more healthy lifestyle by combining this piece of information with others. Let's see what happens in the next few years. Another example, which I guess is interesting because it always deals with prevention setting. People with high cholesterol level with no coronary events are suggested after a certain level of cholesterol to take statins, okay, to avoid any coronary events. Some studies that were able to genotype for polygenic score for coronary heart events people were able to demonstrate that the statin therapy were incredibly effective among those at higher risk of inherited risk of coronary events. So it is possible to think in the future to better motivate people to being also adherent to the therapy by telling them that they are at high risk and they really benefit a lot from the therapy. I don't know, it's just, a guess. And lastly, mammography. We know that today we do mammography, which is secondary prevention, a screening program in the same way we did 30 years ago when we started, at least in Italy. 20 years ago we started in Europe. Is it possible to think to advance the way? This is something that there's been a lot of discussion across Europe. So very soon, probably this will change because some polygenic score seems to confer the same risk at 20 years of a woman that has at 50 years. So me, myself, I was coordinating in the past few years this Marie Curie project, and we tried to summarize in some papers, then in a report directed to policymakers, which are recommendations that everybody should keep in mind when thinking about incorporating all this personalized medicine innovation in the preventive setting in relation with chronic disease, because we really need the evidence. I mean, making whatever prediction of risk of disease, like Alzheimer's, do not have something to do to prevent it, it can be very worrying, okay? So we should really pay attention about that. So evidences of clinical utility also, not of clinical validity or analytical validity only, and also the ethical and other issues. So conclusions, I try to summarize what are, according to my view, the key drivers and requisites to harness digital tools for personalized healthcare. And I think that, generally speaking, again, scientific innovations offer really amazing opportunities. And public health professionals have really a special role because they really have to ground their advocacy towards policymakers on very strong, solid scientific evidences and analysis. So thank you for the attention.
Thank you. Thank you. Thank you very much, Stefania, for this very interesting presentation with a number of concrete examples. I just have a simple question, because you also, in your conclusion, said that citizens' awareness is a crucial issue. I mean, if all of this research that you do and many other people do and in your network find indeed that you can identify certain groups or even certain people who have, let's say, a higher risk of a certain disease, but how can you convince those people to go to a test, go to an examination, to check whether indeed that risk is likely to materialize?
Yeah, it's a difficult question, and I have no final answer on that. First of all, there are huge inequality in access to this kind of test, okay, because they have some cost. So there are a lot of reimbursement issues behind. So let's assume that poor people can access. If they can access, then we don't know whether this can trigger changes in behaviors, because regardless of the inequalities, but generally speaking, people, at least in some European countries, have a very low poor health literacy. In Italy, it's one of the lowest in Europe. So I'm struggling myself to understand to what extent this citizen can understand what I say, because even physicians sometimes do not understand. So when it comes to citizens, they do not understand what is the meaning sometimes of the danger given by alcohol, how they can understand the genetic. So it's very difficult, and some trials, randomized trials, attempt to understand if people across all the socioeconomic status change behaviors after they give this information. They do it in the first month, they lose it in long term. These are the very first results. But I hope that maybe digital health can help. There are a couple of projects, European ongoing, try to combine these informations. Maybe, giving more pressure, but again, issues of privacy are there, to people, to see, okay, you're making progress. So they feel more motivated to go ahead once they have the information on the genomic. But there is not magic, solutions, also because people have to be convinced themselves that they are co-producer of their health. It's not like they are passive. But this is, again, something that maybe rich people understand. This is what the reports say. Poor people have a lot of troubles on that. So we should really be able to reach everybody.
Many thanks. Now let's see what the industry would say about that. Industry representatives. The floor is yours.
It's my turn? Okay, let's see whether... Okay, very good, very good. Before I start, all of my slides, at least, I think, will be hopefully made available to you. So if you're... And I hope there's a plan to actually share these slides with everybody. So don't worry about taking pictures. And if you give me a business card afterwards, I'll mail you my slides. So MedTech Europe is the trade association in Europe for the medical technology industry. We're including diagnostics, medical devices, digital health. We have about 130 multinational corporations as members and have also national associations. So we very often claim to represent the medtech industry as a whole. I want to focus on digital health and the opportunities. This morning, and before I show my slide, maybe I'll take a step back. Martin Seychelles said this morning that the key about digital transformation is not the digital, it's the transformation. And the real new thing that digital offers is that it makes information fungible. What does that mean? It means that Martin also cited the poor healthcare professionals who now are reduced to the role of data entry specialists. But what the real key is that it makes information fungible. So and it makes it reproducible. It makes it shareable. So the information that these people type into their records can be shared. It loses. It unties the healthcare from the hospital or the doctor's office. Everybody can access this information. In theory, the patient can access this information. A patient can get empowered. They now no longer have to go to the doctor, to the hospital to get this piece, to get information about their healthcare. They can access it, in theory, on their smartphone everywhere else. You can remotely monitor. You can empower patients to monitor themselves. You can do something like the mHealth, the smoking cessation program on mHealth, because you give people information at their fingertips, and that of course creates a powerful driver for change, because suddenly patients are empowered. They can Google health information, and it of course creates fissures in terms of the culture of healthcare, which used to be that the doctor knows everything and you know nothing, and that creates powerful pressures, but it also creates enormous opportunities, which I'm going to go through really quickly. partly, and I think the state of the healthcare report also cites the potential of wearables. We now have these wearables. I have a Fitbit. We can even do ingestibles and portable devices. They can send data to the healthcare professionals. They can send data to your loved ones. A young person, teenager with diabetes, can actually have their parents can enlist their parents in terms of monitoring their health. We all will at some point have to take care of our parents. We all may become the grandparents who need to be monitored remotely. Now we no longer have to take these people into supervised care. They can stay remotely, they can stay independent longer at their houses, at their home, and be monitored remotely, provided that we get this data to be shared in an interoperable format. And I talk about this in a minute. The other piece, and I started touching on this already, the remote aspect of this is you now no longer have to go to the doctor. A person, again, maybe citing the person with diabetes, he used to have to go to the doctor like every quarter or so or more often to share their data, to have their sugar levels controlled. He or she can now just send in their data, and maybe at some point this all can be taken care of an algorithm that relieves a lot of endocrinologists and diabetes specialists of the burden of the pressure on their time, and they can really focus on those problem cases where their intervention is most needed. Telehealth, maybe one other piece. We can now deliver healthcare remotely. And that creates particularly incentives for rural regions that have an issue with healthcare access. We have, and I think you cited some of this, particularly with your reference to genomics, we have the power to now analyze all of this data and actually have medical devices powered by artificial intelligence to, in some cases, even assist and in some future maybe even replace a doctor that needs no longer to be taken care of, because this can be taken care of by an algorithm. And finally, data sharing creates incentives for the healthcare systems to automate, to have more intelligence. It creates, I sometimes liken it to the power of supply chain management. You now have more overview of where the patient is at a given time. You can relieve pressures on your hospitals. You can get patients through your healthcare, through your hospital a whole lot faster. So in some, digital has the potential to make healthcare better, safer, and more efficient. And it, of course, also leads to, and that's something that we do not always capture in our many reports, it also improves the quality of life, because we very often are focusing only on the healthcare outcomes. But being able to stay longer at home, being remotely monitored, that is a tangible benefit, improves the welfare of European citizens. For that, however, infrastructure and investment are needed. I did take a very close look at the companion report, and I think it's very good, but I find that the notion of digitalization isn't really captured in it. I think that it makes references to wearables, to apps, but what we really need to create is an infrastructure that allows for this kind of data sharing. And I wanted to make a pitch here for a piece of work that a German think tank did about a year ago, the Bertelsmann Foundation, on behalf of the Bertelsmann Foundation commissioned and some very good consultants did to analyze the digital health systems in detail. So they looked at 16 different countries. I picked out some of them because they also looked at Canada and Israel. And I wanted to give you an idea of what kind of infrastructure is actually needed. Those of you who were here before the break know that I asked about Estonia, because Estonia comes in at almost the very top in terms of the e-health infrastructure, because because they created a lot of the institutional, legal, and technical requirements that are needed. What is needed for this? You need a unique patient identifier. Some countries do not yet have a unique patient identifier. If I don't know that Stefania is Stefania, and because there are sometimes more people Stefanias than I can capture, then I have an issue. So I need to identify that person uniquely. We need to have the legal frameworks in place, a data protection regime. We need to have legal certainty. We need to have standards and specifications for how we want to process the data. We want. We also then want probably an electronic health record where we keep this data, where we store this data for a citizen-based healthcare record, not the type of thing that you get in when you go into a hospital. They will make a medical record, but that hospital record is not shared with other people. It's not the patient record. Martin made references to how we exchange electronic health records across borders, but the sad truth is that probably only 8 or 9 or 10 or so countries have that kind of EHR to begin with. Finally, more advanced services like e-prescription and telehealth services, many countries are lagging behind. These numbers are now getting almost 2 years old. We would like to see more of that type of assessment. It doesn't necessarily have to be the state of health framework, but fund some decent, some smart consultants to do this on a regular basis. That's something that we would like to see, because if you measure it, then people will improve. I think that's what I very much agree with in the conversation this morning. If you measure it, if you feed it back to policymakers, then they will act on this. My final slide. So we as MedTech Europe see these pieces here as the key barriers for the digital transformation. You've already mentioned culture, skills, and trust. I think those are some key elements. We also want to, and this is, we're an industry, so we always want to have a balanced regulatory environment. Let me just maybe step back here and say, the medtech industry is a very regulated environment, and we like that. So we're not the type of people, American Republicans or so, who don't want government to do anything. We like regulation. It needs to be stable. It should be consistent. And what we see, for example, in privacy, we like the GDPR. We comply with the GDPR. We would love to see a whole lot more consistency across borders, across Europe, because if you are a small startup and if you want to sell your app in 27 different countries, it would make you don't want to comply with 27 different GDPR regimes. That's the key point. For us, the most important pieces, of course, and those are pieces that are voiced very rarely by other actors. That's why we're making this so consistently. Is interoperability. We need more interoperability. Everybody decries the lack of interoperability, but we see the key to-do ask here is for the Commission and for the member states. Yes, we have the electronic health record exchange format that Martin mentioned last year. I think we need more of that, and we need more teeth put into this. If you want a European health data space, you better get going, also mandating and regulating and telling people what kind of data formats you want to have the information captured before you start, making them conform in a European health data space. That is a key priority. But maybe perhaps because it's money, it's the most important piece. We need more consistency on financing reimbursement. Martin said it this morning. We need better cooperation to define the criteria how we reimburse digital health applications, digital health technologies. We recognize that we have 27 member states and that healthcare and healthcare financing is a national responsibility, but being able to see more consistency in terms of evaluation and assessing these digital health technologies would be something that we would love to see more of. And with that, thank you, and I hope this was useful.
Excellent, thank you very much. I will open the floor immediately, but I can't resist asking you a question, and and then Martin to respond. Because if I understood you well, you said many nice words about the companion report, but you also said a major critic, and it's always good if there is some disagreements between panelists. Namely, you said that the notion of digitalization doesn't really captured by the report. So I would like to, ask you to little bit discuss of this issue. So can you a little bit explain a bit further what you mean by that? And and perhaps Martin can respond if he agrees. Probably he will disagree. But just in
very happy. And let me first tell you that I think the State of Health report does some valuable and some really good work. Very often digitization, it's observed that digitization moves so rapidly that you really can't rely on kind of like the traditional notions of intelligence. I made a point here that this piece of work here is already 1 year old. I think in the last year, in that year alone, in these 2 years, for example, the Austrians already started putting in launched their electronic health record, the ELGA system. The Germans just at the beginning of this year started the digital healthcare reimbursement process. So anything that you do with a 2-year cycle may already be old at the end of that 2-year cycle. So maybe perhaps just stepping back, I saw in the companion report, for example, and perhaps a proxy of digital transformation, how many people actually access information online. And I think that for us, for me, is not necessarily a good indicator of the digital healthcare transformation. The type of criteria that I saw applied in this report here, the infrastructure, putting the infrastructure in place, having a vision and a strategy, having stakeholder input, having also a solid social and political conversation about health data and under which circumstances it could be shared. Those are all elements that I didn't see capture, but they are critical for having a digital health infrastructure in place. And I'm consciously not just talking about technical or legal infrastructures. I'm also talking about the cultural and social understanding. I mean, the German. I'm personally from Germany, and I follow that debate very with great attention. The Germans are always. They haven't yet had a solid, good agreement on data sharing, for example. And every time there is another report about a data leak or so, it immediately gets front and center attention. That kind of work of getting all stakeholders to agree what to share and what not to share is critical to get a sustainable digital health infrastructure in place. So if the State of Union, the State of Health report could take some of these elements on, would be great, but I'm almost inclined to say it would probably require a separate piece of work, building perhaps on what's already been done.
Thank you. Would you like to respond, Martin?
I can respond, but we are not necessarily in disagreement, I think, because this is a very dynamic field, and as Michael said, I mean, the information of today will be outdated very soon. So I agree that a certain kind of benchmarking among the member states may provide the impetus for them to speed up the work. I mean, for the companion report, there was a dedicated chapter on digital health. Whether more could have been included or not, I mean, that's for debate. But I agree with the general point that there is a need to monitor the progress in the member states. And as I said, we are currently also engaging in the studies at this stage, focusing primarily on the regulatory or legal frameworks that are in place in the member states. We are mapping basically the landscape in the member states. But we'll be also touching upon the issues of the necessary infrastructure that exists in the member states, or that would be needed. What are the plans of the member states? What are their health data strategies, if you wish? So this information will be coming up, and we will be, once this is available, we'll be happy to share it with everybody.
Maybe just one more point. And part of this is also the information is there somewhere, but it may just need to be put out there. For those of you who know me, I'm active on Twitter, and just last night I saw that the Joint Action for the eHealth Network is right now meeting. I think it's in the Netherlands. No, it's in Portugal, and they're discussing right now the various strategies for the secondary use of health data. I love these people dearly, and I know many of them, but putting out a tweet that they're just now looking at a comparative analysis of their secondary healthcare data strategies is kind of daunting if you're not part of it. So I tweeted that I'd love to be a fly on the wall, and I think I've had already some people retweet this. That kind of information should probably be also more transparent, because it will spur more people into action, and it allows also stakeholders to have a say in this as well.
Yeah, so let me now open the floor for questions and comments. If you'd like to ask a question or make a comment, please indicate me. Please briefly introduce yourself. There's a question from the lady over there. Yeah.
Thank you for your presentations. My question is about unlocking the potential of telemedicine. And I don't know if I'm correct in thinking that telemedicine would be, for example, online consultations with doctors. That would include, would telemedicine include that? And why it's, I saw your, one of your slides, that there was only one country indicating telemedicine as advanced. And why do you think there is so much skepticism about online consultation, especially when it comes to mental health and consultations one might have with psychologists or psychotherapists? If you could comment on that or reflect on that, I'm curious. Thank you.
Thank you. Thank you, Ms. Kokot. Thank you. Is there another question? Yeah, Caroline, please.
Thanks a lot. As the session is also about digitization of health promotion, I find a bit in the whole of the discussions and the narratives that as if apps and so on will improve health, if this is the deep magic bullet that will do the trick of preventing diseases. And it can be a very big motivational factor to change behavior if you know what may happen, or if you have all this data. But we know that changing behaviors to more healthy behaviors is not only motivation, but also very much the capacity and the capability of people to act upon the information. You mentioned health literacy, but there's also issues like, do you have the monies to buy healthier food, or is there infrastructure to be physically active or active travel and so on? And the opportunity. So the opportunity that you have to act and to change your lifestyles. What is it in your family circumstances or in your homes? I mean, often people, and particularly vulnerable people, are sort of locked in the day-to-day situation of unemployment or bad air quality, and they would want and would love probably to make changes, but they may not have that. So I would plead for indeed looking at digitization and technologies for better information and for how that can be helpful, but always in addition to the broader context in which people live and work, what their opportunities are, what their capabilities are, because together we have true comprehensive approaches that may change. But sometimes in all of these digital conferences and so on, I feel it's a bit, oh yeah, new gadgets and trendy, and it's nice, we can make money, and and I miss a bit more the structural approach. So I would want to hear what you have to say on that.
Thanks very much. Just the lady behind you.
Hi, my name is Mariana Baggio from the Joint Research Center, and I'm a behavioral economist. And today, a lot of people have mentioned changing behavior, and you've mentioned how the information about your genomic profile actually works at the very beginning, that stopped working. And I've seen a lot of potential for the application of behavioral insights. But in a way, it's not embedded in your approach, or it seemed like it doesn't take not a central role, but quite an important role. So I can't see if this is something more like an intuition, or if it's more like something that you intend to embed formally and structurally into, like, for example, all the devices, all the mobile devices. So I've seen a lot of potential, maybe not much structural approach to the behavioral insights. So what do you see for the future? Do you see it coming in as more prominent or not? Or what do you see for the future in that sense?
Thank you very much. And there was the colleague from the Commission there and another one at the back.
Hi, hello. My name is Federico Pratellesi. I work at the European Commission at DG Sante. Thanks again for the great, very interesting presentation. I have a question for Michael and Stefania. I was wondering, during your elaboration of the topic, you were mentioning en passant that the share of people that seek information online via, online fora, like on the internet, it's not a good proxy indicator for the potential of like health promotion, disease prevention, and the effect that digitalization can have on it. I was wondering, like, why particularly, and if you had like a better proxy indicator for it in mind that could potentially be used. Thanks.
Thank you. There was a gentleman over there.
Bertolt Schilling, Consilius Europe, and I also ask, of course, as a European citizen. Thanks for the presentation, it was really interesting. And I was also wondering about all the new and exciting changes, how that would impact the health professionals, because their role would need to change if a lot of data will be measured on the patient by variables, by ingestibles. How would their role in the future change? And also, second part, the human aspect in treating diseases, to have like a personal one-on-one contact. Is there a risk that this could get lost by not having direct intervention and basically just interacting with apps and other digital means and not seeing the practitioners in person? Thank you.
Thank you very much. I think I'll give the floor back to our kind speakers, which received many different questions on telemedicine, on whether it's a magic bullet or digitalization would need to be looked into the broader context of capacities, capabilities, and opportunities, on behavioral insights. There was a particular question to Michael on why doesn't the number of people looking info online is not a good indicator on what else to see. And the last question was also, I think, very well made on what impact it would have, digitalization on health professionals, and what if just the data is get lost and there is no follow-up. So there are many insightful, interesting questions. Feel free to pick whatever you want, but I would appreciate if all questions would be answered by at least one of you. So who would like to start? Yes, maybe the ladies first, if you...
Michael, please.
The ladies first, if you can suggest.
Well, thank you. Okay, so I try to address the two issues that have been raised from Caroline and the other colleagues from the Joint Research Center. So I think there are windows of opportunity to act in a way that people can change their behaviors being convinced from the omics, I mean, the background, plus the use of mobile health technologies. But the point is that a lot of, as I said before, the physicians do not have an understanding. There is a very recent survey performed across European Public Health Association members. The vast majority are physicians. They have not an understanding of what is a polymorphism, a mutation. So keep in mind that genetic counseling, genetic as a medical specialty, there are very few doctors across Europe, okay? It's one of the specialties for which there are the lowest number of physicians available. So we cannot think that geneticists would be available to consult everybody. So this would be in charge of primary healthcare physician of the specialties. But when people at 20 years age get this kind of testing, because some days it will be done, all the physicians, maybe other healthcare professionals, not only physicians, maybe also nurses, others, will be in charge to help a person interpret this, the meaning of that. Anyway, this we don't know yet will trigger any changing behavior. So as long as I know, evidence are still stocked. So we have, at least I'm an epidemiologist, so I want to rely on evidences, okay? So there are a lot of studies now initiating also because of the release of data from the UK Biobank. So hopefully we have a large, powerful studies, because a lot of trials have been mentioning those reporting that you stop at some point, you lose the motivation, you start smoking again, are based on very few numbers. So they're very underpowered to make final, answer to the question. Concerning the issue of opportunity, I think also the workplace setting is an important place. I do understand your point that there has to be the infrastructure, the place where people can engage physical activity for free. I mean, it's not only behavior, we know that. But also working at workplace can be a solution to improve behaviors. But again, those who don't work because they have different kind of problems are left behind also in that. So we really have to struggle thinking about different possible solutions to bring to policymakers. And just also another point I want to touch upon, the issue of direct-to-consumer genetic testing, because this is also something that is very relevant in the United States. So people can buy, spending some hundreds or a few thousands euro, depending on the kind of test, a test online, okay? There are a lot of companies in the United States. This is a huge market. The Black Friday, it's one of the most sold stuff. So in the United States, there's a huge pressure from the industry to sell the direct-to-consumer genetic testing. And the report is something that the normal person cannot understand. As I said, not even a physician. It's a probability to develop whatever chronic disease that also is updated from the industry every year, because, data accumulate and evidence also change a bit. In Europe, the legislation is a puzzle, okay? So in France, they're forbidden, in Italy, they're allowed, whatever, but likely in Europe, a very small percentage of people already did the direct-to-consumer genetic testing. But this is something we should keep in mind, because at least in the United States, the Medicare, which assists elderly and disabled people, doubled the expenses of genomic testing in elderly subjects for useless things. There was a Reuters news, I think it was on September last year. It was fraudulent, because also the answers were not even provided to senior people. It was completely useless, and doctors took money from that. So there are some horrible situations where industry do not go in the right direction, while we want to create a win-win strategy with them, because there are a lot of good things there, I believe. But still, when you have to fight this information, and it's not that easy then to give a simple overview and answer to a normal citizen.
Thanks very much. Michael, please.
Okay. I think I'm not on purpose going to not answer some questions, so shout at me. I think the lady regarding telemedicine, as far as I'm concerned, or as maybe my industry is concerned, the barriers for telemedicine are relatively straightforward. It's money and it's rules. There are still countries in Europe, or maybe they're changing it, that require for reimbursement that a doctor sees a patient in person. So, so that is already a barrier. The second is, of course, if I don't get reimbursed for seeing somebody by Skype or whatever. But if the rules require that I, as a doctor, only get reimbursed if I see that person if I see the patient in person, then I will not offer telemedicine services. So it's pretty straightforward. Where you see these kinds of rules and reimbursement rules relaxed, you will see telemedicine, because everybody likes it. Nobody wants to spend time, in traffic and going to the doctor or going back if they have the choice and if there are alternatives available. And that is perhaps, the gentleman asked, what is the future? I think you will see more choice. I think when I remember my own watching of Starship Enterprises, the various interventions, I think at the beginning there was still Scotty, who was an intermediary, the doctor between a computer and whatever Starship Trooper, Star Trek Trooper just needed medical care. And I think in the latest Enterprises of Starship Enterprise, in the latest editions or so, there was only a computer voice talking without a person present. And I think what we will see is more choice. Doctors being able to focus more on those cases where it is needed. But many of us probably, if we get the same type of information, through an internet exchange than through and face-to-face interaction, we probably prefer the internet exchange. Look at e-commerce. I do a lot of shopping on Amazon because it's fast and easy and when I want it. So I don't have to adhere to doctor's appointments. So you will see more choice and you will see more sensible and efficient deployment of resources, because nobody's talking about replacing doctors. We have too few of them. Nobody will replace nurses. We have too few of them. If we can relieve, if digital can help relieving that pressure on our healthcare workforce, I think then we've already made a big contribution. I think regarding your indicators, so let's focus on those indicators where a government can actually make a difference, because a government makes a huge difference in the healthcare system. So in analogy of what I was talking, a government will have difficulties kind of improving the use of online fora. A government will find it difficult to say, well, how can I improve this? But if a government can actually provide a citizen-based electronic health record where information can be shared, accessed with control by the person whose data we're talking about, that's already a huge win. So focus on those indicators in digital health where a government can actually make a difference. I would love to see more of that, and I would like to see more transparency, particularly from the Commission, maybe other sanctioned reports. And of course, you can also use, the use of health apps or the use of an electronic health record. You will find, quite similar to today, like, look at me, I'm fortunate, I'm relatively healthy. I haven't used health services in 2 or 3 years. I've done a routine checkup or so. That's what we want. We have this 80-20 system, a problem in healthcare services. The 20% who use who use 80% of the services, maybe we should only focus there and look at how many people can actually can access apps rather than in-person healthcare services. That can be an indicator, but very happy to talk more with you about that. I'll think again and shout a question if you'd like. Maybe I shouldn't hog the microphone.
Yeah, I think many or most of the questions have been answered, but I would like to come back to some of those that were addressed already by Stephanie or Michael. I mean, especially on the telemedicine question, because I agree. I mean, this is an area where there is still some work to be done, especially in the member states, and to. At another example where when we realized that there are no rules or the rules are missing in the member states are, for example, the European reference networks and the virtual consultations that we are promoting between health centers and experts who are based in different member states. And we realized that there is probably going to be in the long run a problem with reimbursement of these services, because I mean they involve several providers from different member states. And when we try to dig a little bit deeper into the issue, we realized that even within the member states, if services are provided by a number of healthcare providers, the issue is not fully addressed. And sometimes even just the fact that they are provided remotely. I mean, we are using for the European reference networks are using these virtual consultations. So using the technology instead of bringing patient physically in front of the whole panel of experts. I mean that there are clearly gaps that need to be felt at the level of the member states. So. I think it's a question of realizing what potential these services have to offer, of course, to the patients, to the professionals, but I mean to the healthcare systems as such in terms of efficiencies and savings and so on. There was also a question on the health professionals and their role in this whole process of digital transformation and the fact that they are faced with new technologies. Obviously, I mean the way how healthcare is provided and delivered to patients is changing. So also the training and education of health professionals need to be adapted. I mean, so the digital skills are one of the essential preconditions for successful completion of the whole digital transformation. So there will be definitely a need for change in the curricula for education of healthcare professionals, but also in the lifelong continuous training of these professionals. So we are, for example, in contact and I mean discussing these issues with the university hospitals and so on. But in my personal opinion, I mean, is indeed that in the long run. Health professionals will not be replaced clearly by new technologies. I mean the technology. I mean, we are also receiving these questions in the context of the artificial intelligence. Is artificial intelligence going to replace doctors? I think the answer is clearly artificial intelligence and the digital solutions will provide important assistance and will complement the services that are currently provided by the professionals. But health professionals will always have a role to play. But the whole way how they are trained and prepared for their profession will need to change. That's for sure.
So, thank you very, very much. Our time has just passed. I wouldn't summarize our discussion, but I have to say I personally learned a lot. I found it very, very fascinating how the digitalization or the whole digital transformation of healthcare is actually ongoing, and the different insights you gave from different perspectives was very interesting to me. I hope it was also very interesting to you who participated. And let me thank not just the three excellent speakers, but all of you for being here and participating in discussion. So again, thanks very much and hope to see you at other Bruegel events.